usually wake up, have a couple hours of semi-functioning, and then I crash and I take a long nap. And then for the rest of the day, I can barely get anything done. And that's what it's been like for a few months. And I have extreme back pain and abdominal pain. And I am on prednisone. If it weren't for the prednisone, I wouldn't be functioning at all. We can't find any specific autoimmune issue that's causing this, so it's probably just from immunotherapy and probably from cancer as well. I hate to admit that, but I have been worried about the back pain so much that I went ahead and bumped my CT scan up a month early, and I didn't get the best results. So I have tumors in my pelvic area that are growing, and I have urine backing up into my kidney. They can't quite see exactly what's happening, but this has happened to me before, and it was a pelvic mass that was wrapped around my ureter, causing the urine to go back up. So that was a tough area during my CRS surgery in 2020. Removing that tumor was really difficult, but they were able to. And they had to reconstruct my bladder and reinsert the ureter into a new place. So I'm pretty sure that's what's going on with the urine backing up into the kidney, which is causing pain. So I'm waiting for an appointment with a local urologist to discuss what to do for now. The options are a ureter stent, which I've had before and I can handle that. It's a simple procedure. Or a nephrostomy tube, which I do not want. So I'm going to go for the ureter stent. And in the meantime, I'm also waiting for my surgical oncologist to review my imaging, and I will speak with him directly through a video appointment afterwards to see if he'd be willing to do a debulking. I am not a surgical candidate anymore, but I am in quite a bit of pain, and usually he takes that into consideration, and I'm sure would possibly do another surgery if it makes sense. So I don't know what's going to happen, but my oncologist is also reaching out to my other oncologist. I have a local oncologist here, and then I have an oncologist at UC San Diego that works along with my specialist. So my local oncologist is going to reach out to the oncologist there and talk about any possible clinical trials again, and his thoughts about me resuming immunotherapy. And I'm kind of scared with what's happened to my body with my autoimmune symptoms, but I would rather do immunotherapy, and I can stay on the prednisone because I'm at a lower dose. He said as long as I'm at 10 milligrams a day or under, it usually doesn't cause a problem. So I told him I'm happy to resume treatment after I speak with the other doctors to see, to talk about the plan going forward, and if it's decided so, I'll resume immunotherapy second week of December. So that's where I'm at. My energy is extremely low, and it's been really hard for me because I have a big family and I have a lot of friends that I love so much and things that I want to do, but I'm so exhausted. I'm sleeping a lot, and it is what it is. I have to kind of listen to my body, and so I'm not able to do a lot of things that I want to do. And seeing growth on my CT scan, brings me back to the deep conversations that I need to have with my loved ones. And my hubby and I have had to talk about things that stress me out that don't stress him out really. I worry about him and any messes I could leave behind, and I just would feel better if I could take care of things before anything bad or worse happens to me. So we've been having those conversations, and that's really important. So I need to officially get my death planning planned, because I will be buried at home. We're allowed to do that here in Oregon, where I live. but there is a process to it, and so I just want to take care of that, so it's already done for the most part, and put the coordinates in for the county so it's ready to go, and talk about all that stuff. So my mom has been amazing and very supportive, and I know it's really hard on parents seeing their children go through this and having to think about that, but unless a miracle happens, eventually this will take me, and I'm a control freak, and I want to plan as much as I can and take care of as much as I can. So I'm in good spirits today. I'm fine. Of course, when I got the results, I was a wreck because I did not want to know. Since I'm not a surgical candidate and there really aren't any new treatment options for me, I just don't want to know. I kind of just want to live my life not knowing until it's over. But with the back pain, I was wanting an answer for that, and that seems to be the kidney. So unfortunately, I have to deal with the cancer. So anyway, I'm doing okay. Just know that if you're a friend of mine, I don't have energy for any extra things, and it really does help many people, caregivers and other people with illnesses. A simple text or a message saying you're thinking of me really means a lot. Inviting me, especially if I'm really close to you. There are a few people like inviting me to things, but understand that I may not be able to go. If I feel up for it, I'll go. But this goes for other people as well. Like if somebody's not feeling or doing good, don't pressure them to do things they may not be able to do, but let them know that they're welcome to come if they're up for it. So anyway, that's where I'm at. I'm okay, like I said. I've had my freak out and I'm in survival mode again. So anyway, thanks for listening. That's my update, and everybody have a good day.